Americans will be paying 30% more for Gilead Pharmaceuticals coronavirus treatment, also known as remdesivir, even though tens of millions of dollars in US taxpayer money has actually gone toward the research and development of this drug. Now, remdesivir will cost $3,120 for a typical US patient with commercial insurance. So that means that the full treatment will cost that much. Insurance will be billed. And depending on what your deductible is, you will pay that amount out of pocket, right? If you have no deductible, you won't pay out of pocket. If you have a giant deductible, you absolutely will pay out of pocket. And what's worse is if you have no health insurance at all, if you happen to be one of the tens of millions of Americans who was laid off during the pandemic and you lost your health insurance as a result of that, and can't afford to just buy insurance on your own for obvious reasons, well, then you're expected to foot the bill. Now, the drug maker said that it will sell remdesivir for $390 per vial to governments of developed countries around the world. And the price for US private insurance companies will stand at $520 per vial. In the US, that means Gilead will charge a lower price for government programs like Medicare, and a higher price for privately insured people. Seems like there's an upside to having government healthcare like Medicare, right? But anyway, I do want to just quickly go to a video of the Gilead CEO who was asked, why is it that US citizens are going to be charged 30% more for this drug? Take a look.
Tell us about your decision to set the list price 30% higher for US insurers than for government payers. Some are pointing out that US taxpayers helped fund the NIH trial supporting the data behind remdesivir's approval or emergency use authorization. Why set it 30% higher for US insurance companies?
Right. So for everybody's knowledge, for every medicine in the United States, there are always two prices. There's a government price, and then there's a price for private insurers. That's part of the system in the United States, which allows for required and expected discounts to the government off of every medicine accordingly. What I want to assure you, Meg, is that at both of those prices, we focused on making sure that all patients would have access. And based upon this price level, based upon the immediate savings to the healthcare system that this medicine provides, based upon programs from the government, whether you're covered by a private insurer, whether you're covered by a government insurer, whether you're uninsured with COVID-19, there will not be an issue with access for remdesivir.
Now, sounds like our healthcare system is trash because his answer to that was, well, this is just how our healthcare system is set up. There's a discount for Medicare, and for everyone else, they can go F off. No, but we've made it affordable for everyone, even if you don't have insurance. So in a country where nearly half of Americans cannot afford a $400 emergency, and that was before the pandemic, before tens of millions of people were laid off or fired from their jobs. How do you expect them to come up with over $3,000 to pay for a treatment they need in order to survive this virus? It's just ridiculous.
Yeah. So look, we want folks developing good drugs, and this looks like it is a good drug and is really going to help in recovery from coronavirus. So that's good, and it does save the hospitals money because on average, people leave the hospital 4 days earlier if they're on this drug. So no one is against it. Everybody's in favor of it. And we're also in favor of systems that allow good incentive systems for the drug companies to create these. But there are a couple of buts here. First off, if the government participated and helped to fund it, well, okay, do we have a part of the equity of the company or at least that drug? Is there anything coming back to the taxpayers for that? Are we getting a heavier discount than other countries that did not fund it? No, the reality is actually the reverse. The US government and taxpayers are getting nothing for that drug, and US consumers and government are being charged more than other countries. And some of that is understandable. Developing countries would have a very hard time affording this, and they need it to save lives, and that's important and moral. But the reality is that the company still makes profits even at the price that they charge developing countries. So they would still make a profit if they charge that here. It's just that our government is really bought and owned by corporations. So they set the laws in a way that gives drug companies sometimes as much as 12-year patents. That's a monopoly where no one is allowed to compete with them. They say outrageous things like you can't negotiate the drug prices. The government is not allowed to negotiate drug prices. It's illegal, which is unbelievable. No other government does that. And that's because we allow legalized bribery in this country. And then finally, if you're out there and you're saying, well, at least I'm covered. He said I'm covered no matter what. Not exactly. If you're middle class, for example, and you have health insurance, it might come out of your deductible, in which case you have to pay thousands of dollars for this.
Yeah, that's exactly right. And just to give you some numbers in terms of how much taxpayers have contributed to the research and development of this drug, based on research by Public Citizen, it's estimated that US taxpayers contributed $70.5 million to remdesivir research and development overall. And keep in mind that the number that I shared with you all, the $3,120 for the treatment, is only if you are in need of a 5-day treatment. Let's say you actually need longer treatment, a 10-day treatment. It would actually cost the government $4,290 per patient, but it would charge US citizens $5,720 if you have private insurance or no insurance at all. So this can cause absolute financial devastation for so many people. And again, we have insane numbers of unemployed people right now because of all these businesses shutting down. A lot of states have decided that they're going to shut down their economy again, following a surge in new coronavirus cases. As many as 14 states have reversed their reopening plans. So more people are likely to remain jobless or even end up jobless if they haven't been already. This is a system that's broken. And if this pandemic isn't enough to persuade people that we need a single payer healthcare system, I don't know what will. I mean, you have the CEO of Gilead making it abundantly clear in that interview that the government provided healthcare, Medicare in this case, gets a deal. So imagine if we had Medicare for all and they had no choice but to lower the prices to something reasonable for a single payer healthcare system.
Yeah.
So anyway.
Yeah, last thing here. Look, I'm not interested in anything that's unfair. And if the government put in 70 million, and Gilead's telling the truth that overall they spent about $1 billion developing this, well, then the government equity would be relatively small. But good, at least let's do that, and let's acknowledge the government scientists who worked on the patent. And then in terms of the price gouging or not, the market thought it wasn't enough. They only went up 1%. On this announcement. So apparently the market thought they should have gouged more. And so in terms of Medicare for all, he just made the best case you could have for Medicare for all. This would cost the country billions of dollars less if we had Medicare for everyone instead of for people above the age of 65. So even in a system where the government is not allowed to negotiate drug prices, the government still does better than private insurance. And we could save tons of money while still leaving profit for Gilead to develop drugs like this and be rewarded by the system.
Don't miss your chance to win a trip to Los Angeles and have dinner with Cenk, Anna, and me. Just head to tyt.com/dinner in LA to register to win. Sign up for a free Aspiration Spend and Save account. Register your eligibility. Swipe your Aspiration card on daily purchases to gain entries to win a chance to fly to LA and have dinner with the TYT hosts. Not only are you entering to win that dinner in LA with Cenk and Anna and myself, but you're also able to deposit your hard-earned money without it going towards fossil fuel exploration or production. And as a friendly reminder, even if you already have an Aspiration account, you must still first register to be eligible for the sweepstakes.